show, the Southwest Regional Health Authority joins us this morning to discuss women's health tips. Joining us is Dr. Sandy Arthur, the manager of the Health Promotion Unit Acting, and Sally Chandler, patient care coordinator at Obstetrics and Gynecology. Good morning and welcome.
Good morning. Thank you for having us.
Good morning. It's a pleasure to have both of you on the show with us this morning. Getting straight into the conversation, let's start with you, Dr. Arthur. What is preconception counseling?
So preconception counseling is that counseling that occurs before there's even a pregnancy. It is something that we encourage all women of childbearing age to consider with their doctors, as it helps us to be able to ensure that you're going into that pregnancy as healthy as you possibly can. It entails several things. We may do checks on your physical well-being, your emotional well-being. We will ensure that you're on the appropriate supplements. And if there are any conditions that we pick up while we are going through this whole counseling process, because we may actually do blood tests and other investigations, we would ensure that you are started on the appropriate treatment that would also be safe for you to be on in pregnancy. So it's a very important set of counseling that occurs that we really encourage women and would like to highlight for them moving forward.
Now, Dr. Arthur, the first thing that comes to mind with this is, many women, of course, will be consulting with a gynecologist or with their general practitioner. Is it that this is something that we should add on to our medical roster, for want of a better expression?
Yes, it is. It's not something that is readily done. Most persons will first go to the doctor when they actually realize that they're pregnant. But having that preconception counseling helps us to try to mitigate for risk further on in the actual pregnancy. And it is something that can be accessed throughout the SWRHA. You can visit your local health centers and you ask for a check. Simple as that.
And Ms. Chandler, let's bring you into the conversation. Again, welcome to the Now Morning Show. One of the things that Doctor just mentioned is that this is available at the SWRHA. Where exactly can we access these services?
At the Southwest Regional Health Authority, these services can be accessed at all our local health centers. There are 31 health centers and our two main hospitals are the San Fernando General Hospital and Point Fortin Hospital.
Dr. Arthur, let's come back to you. Let's now have the discussion about antenatal care. Can you share with us exactly what it is and when women should begin to access this?
So you've completed your prenatal or your preconception counseling and now you're pregnant. We encourage ladies, as soon as they find out that they're pregnant, that they visit their doctors, their chosen one, whether that is they go to their local health center or they go to their own regular doctor, so that they can now do what we call book their pregnancy and get the appropriate initial investigations that we would require for all women. This entails sometimes ensuring that we confirm your dates, so there'll be an early ultrasound scan done and they will let you know when that is done, and also ensuring that we get the necessary blood investigations done early on for you and the other checks. So antenatal care should start as soon as you find out that you're pregnant.
Dr. Arthur, you just mentioned a term there, book your pregnancy. Can you expound on what that is?
So basically, it is just the fact that you go and you visit and you let your healthcare provider know, well, I am pregnant, so that they can now start that journey with you, because it's going to be an ongoing process. A regular normal pregnancy would usually go on average about 40 weeks. So you're going to be spending some time, quality time with your healthcare provider over this period of time. And it's a time to get to know each other and to also start that process. And we want to start that process well. Unfortunately, we don't always see ladies before they actually conceive. So this is the first time we're meeting with them, and we want to ensure that we can highlight any potential problems or complications early, because once again, our aim is to ensure that you have a safe, healthy pregnancy and that both mom, baby, and family are well at the end of that journey.
Dr. Arthur, you just mentioned something that really is critical. Unfortunately, many times you don't see mothers until they become pregnant. In your experience and what you've seen thus far, what would you say are some of the contributing factors that can cause that?
I think sometimes it is what persons are accustomed to. So when we talk to a lot of ladies, and Nurse Chandler can attest to this, they would say, well, my mother never went until she was 4 or 5 months. You go and join when you're starting to show. So that's something that has been ingrained in many of us. For some other persons, there may be some fears or challenges. Not all pregnancies are planned. In fact, most of them are not planned. And some of them are not necessarily accepted as readily as others for different reasons. Persons may have challenges emotionally, financially. So it is a wide range. But I think for most persons, it is what they are accustomed to, what they have learned.
So we're here working together to reframe the mindset and make some changes. Sally, let's bring you back into the conversation. As we were just discussing antenatal care, in your experience, do you see many women coming in for this? Are they aware that it is available? And where is it available in the SWRHA?
Well, yes, we see women coming for antenatal care, but as my colleague just explained, for some reason, maybe as a result of what they are accustomed to, some don't come as soon as we would like them to come, because as she mentioned, we would prefer if as soon as you recognize you are pregnant, you come to us and you can come again. I want to reiterate at any of our local health centers and at our hospitals at San Fernando General Hospital or Point Fortin Hospital, where you can access that care and we can take you from 0 weeks to 40 weeks of your pregnancy, and so that we can help you manage and have the best possible outcome for you and your baby.
So seeing here that there is access available to preconception counselling, antenatal care, and so much more. And we do have to discuss, of course, the journey itself. But as we mentioned, access to this type of care, antenatal care particularly, Dr. Arthur, is this available to the migrant population also?
Yes, it is available to the migrant population, and they are welcome to come and join any of the local health centers, the one that is closest to them, to start their pregnancy. And if secondary care is required as well at one of our hospital clinics or some of our specialist clinics, that is also extended to them. So we want them to know, because sometimes I guess there is that challenge there that they may think it is not available to them. But antenatal care is available for all pregnant women in Trinidad and Tobago, whether or not you're a resident or a citizen. So the migrant population are also entitled to that care as well.
Okay, now going on to the continuum of care, Sally, who manages the pregnant women that are coming in and goes through that journey with them at the health centers?
So at the health center, the care of the pregnant woman is primarily managed by the district health visitor, the midwives, and of course we use the multidisciplinary team approach. So if the woman has any challenges, she would be referred to the obstetrician right at the health center, and if the woman is deemed to be a high risk for pregnancy or may have challenges such as high blood pressure in pregnancy or diabetes, she again is referred to the specialist clinic at one of our local health centers. For example, Marabella has a specialist obstetrician gynecology led clinic, or at the San Fernando General Teaching Hospital, she can be referred there to be seen by the obstetrician for her health challenges.
Now, something that you just mentioned, and Dr. Arthur, I'd like to bring you back into the conversation for this particularly, is that term high risk. Is something that we see floating around on social media, particularly when it comes to women, and many times it's in reference to being a certain age. Can you clear this up for us this morning? What is determined as high risk?
Okay, so high risk is a wide spectrum of conditions that can occur in pregnancy, and there are different factors that impact on it. You mentioned age. So age is one of them, because we know as women get a little older, they're more prone to having certain types of complications. They're at high increased risk for problems with their pregnancies and even congenital or what persons would term as birth defects. So age is a risk factor. But in addition to that, there are other medical conditions that may throw you over into that bracket. Our nurse Chandler would have mentioned things like hypertension, diabetes, And oftentimes what persons don't recognize, because we just think about medical conditions, there are certain habits or lifestyle practices that you may have that also will put you into a higher risk for complications in pregnancy, and things like cigarette smoking, alcohol use, drug use. All of these things will change your designation as a routine, or what we would say an average pregnancy, to one that may, or we can expect complications, because that's basically what high risk means, that we expect or we anticipate that there could possibly be complications that can impact on both mother and her developing baby.
Thank you for that clarification. Sally, what can the pregnant family expect at the antenatal clinic at the SWRHA?
Well, at the Southwest Regional Health Authority, the pregnant woman and family can expect to have a complete, thorough physical examination by either the midwife and obstetrician. She can expect screening for blood works, as my colleague mentioned before, for example, blood count, blood group, and so on. She can also expect to be screened for diabetes in pregnancy. She will be given monthly appointments until 28 weeks of pregnancy, 2 weekly appointments until 36 weeks of pregnancy, and then weekly appointments thereon from 36 weeks until she has the baby. She also would be given health education on benefits of breastfeeding and other relevant topics, such as how to manage the minor discomforts of pregnancy and to be prepared for labor, delivery, and the postnatal period. Those are some of the things she can look forward to.
One of the things you just mentioned would have been those weekly checkups. And we know sometimes, of course, people get busy. Many women are working through their pregnancy until the specific time and may choose to just delay them a little bit. Is it recommended that that can be done, or to avoid that at all costs? Sally?
You really would want to avoid that at all cost, because again, we want to ensure the best possible outcome for you and your baby. And women are encouraged, and I want to put out a plug there for all the employers in the country. It is very important to ensure that the women who are under your employ, that you ensure that time is given to them to attend their clinic appointments, because it may make the difference between a positive or negative outcome. So
very important. And our final question for this morning, Dr. Arthur, coming back to you, there's a term we've seen going around, respectful maternity care. Can you explain to us exactly what that is?
The respectful maternity care speaks to that care that allows all pregnant women the dignity and respect throughout the entire pregnancy process. And that's not just antenatal care, but also throughout the birthing process and postnatal care. It is a process or a term where we encourage shared decision making, and we want and to ensure ladies that that they are informed about what is happening to them, what decisions are being made, so that they can, because at the end of the day, persons have a choice. They can choose to not accept an intervention or treatment, and they can choose to decline. However, we want that when that lady or that family makes a decision, that it is an informed decision, that they have received all of the necessary information so that they can now make that decision with that in mind, and hopefully make the best possible decision for both themselves and their baby. Key terms there is respect and dignity.
Something, of course, that is so important and very much in line with World Health Day that was yesterday. Sally, before we go, can you share with us some contact information or where we can find out more about the SWRHA?
So the SWRHA, our telephone contact, you get 225-4325. You can contact the health employees desk center at that number. So, and you can get that information. So 225-4325, that is SWRHA's number, and then from there the operator can put you on to the various departments, obstetrics and so on. In this instance, we are speaking about obstetrics, but of course, any other section, you can just ask the operator after you call that main number.
Wonderful. Well, Sally, Chandler, and Dr. Arthur, thank you so much for joining us this morning. All the best and hoping you have an excellent week.